Uterine fibroids are a common type of non-cancerous tumour that can grow in and on your uterus. Uterine fibroids, also called leiomyomas, are growths made of muscle and tissue that form in or on the wall of your uterus. These growths are usually not cancerous, benign, and are the most common non-cancerous tumour in females. This is a picture of the uterus showing the 4 types of fibroids and where they can develop. Uterine fibroids are growths made up of muscle and connective tissue. Not all fibroid causes symptoms, but when they do, symptoms can include heavy 1. Menstrual bleeding 2. Back pain, frequent urination, and pain during sex 3. Excessive or painful bleeding during your period, bleeding between your periods 4. A feeling of fullness in your lower belly, abdomen/bloating. Frequent urination. This can happen when a fibroid puts pressure on your bladder. Uterine fibroids, also called leiomyomas, are growths made of muscle and tissue that form in or on the wall of your uterus. These growths are usually not cancerous, benign, and are the most common non-cancerous tumour in females. Sometimes a person has no symptoms and is unaware they have fibroids. Where do fibroids grow? Fibroids can grow as a single nodule, one growth, or in a cluster. Clusters of fibroids can range in size from 1 millimetre to more than 20 centimetres, 8 inches in diameter, or even larger. For comparison, fibroids can be as small as a seed or get as large as a watermelon. These growths can develop within the wall of your UT hirus, inside the main cavity of your uterus, or on the outer surface of your uterus. Types of uterine fibroids. There are different types of uterine fibroids depending on where they're located and how they attach. Specific types of uterine fibroids include intramural fibroids. These fibroids are embedded into the muscular wall of your uterus. They're the most common type. Submucosal fibroids. These fibroids grow under the inner lining of your uterus. Subserosal fibroids. This type of fibroid grows under the lining of the outer surface of your uterus. They can become quite large and grow into your pelvis. Pedunculated fibroids. The least common type. These fibroids attach to your uterus with a stalk or stem. They're often described as mushroom-like because they have a stalk and then a wider top. Fibroids are a very common type of growth. Approximately 40% to 80% of people with a uterus have fibroids. They occur most often in people between 30 and 50 years old. People who haven't had their first period, menstruation, yet typically don't have fibroids. They're also less common in people who've entered menopause. Most small fibroids don't cause any symptoms and don't require treatment other than regular observation by your healthcare provider. Larger fibroids can cause you to experience a variety of symptoms, including excessive or painful bleeding during your period, bleeding between your periods, a feeling of fullness in your lower belly, abdomen/bloating. Frequent urination. This can happen when a fibroid puts pressure on your bladder. Pain during sex, low back pain, constipation or feeling pressure on your rectum. Long-term, chronic vaginal discharge. Inability to pee or completely empty your bladder. Increased abdominal distension, enlargement, causing your abdomen to look pregnant. The symptoms of uterine fibroids usually stabilize or go away after you've gone through menopause because hormone levels decline within your body. Fibroid that gets very big can distort the inside and the outside of the uterus. In extreme cases, some fibroids grow large enough to fill the pelvis or stomach area. They can make a person look pregnant.